Just to hit on a couple of things, we are looking at many of the same metrics that other jurisdictions within the National Capital Region are looking at to determine our readiness and ability to open back up. Just some of the measures that we're looking at on a jurisdictional basis include our number of cases, our overall number of cases, looking at a sustained decrease in that number in the setting of increased testing. And so as a result of increased testing, which I'll talk about in a second, we're also looking at our test positivity rate, which means, again, that the number of folks that we're catching over time continues to decrease as we scale up and test more people and test people more frequently. We are attempting to create a baseline measure in terms of the number of folks we test and how regularly we test them. For example, one of the early baselines for the state was approximately 2%. As of this morning, we have tested close to 3% of our population in Montgomery County. Our goal is to potentially be able to test 5% of the population on a monthly basis. We're also looking at hospital-related measures, including the number of folks in the hospital with COVID-related illness, the number of folks with COVID-related illness who are utilizing healthcare facilities, including primary care offices, as well as our emergency rooms. And we're looking at the percentage of hospital critical care units being used to take care of those patients. So again, these are measures that we're looking to see a sustained decrease in to demonstrate that we are clearing those hurdles and are safer to open up. Now, a big component of that is the ability to test folks. And as County Executive Elridge has mentioned, we've talked about it before, we are close. We're finalizing details, but we are going to launch an aggressive effort that would allow for us to use some less invasive techniques to be able to screen and test our essential employees, because those are the folks who we've asked to come out in the last 2 months to continue to work and provide services and keep things moving, but also could potentially be those who are more likely to have been exposed in their time out in public. So we're continuing to work on that, and we'll be releasing those details shortly. And another piece that's important to our recovery plan is the concept of equity. And we want to make sure that all of the different measures we're looking at are being experienced by all segments of our population, and all of the efforts that we plan in terms of our recovery pieces are looked at through a lens of equity, however you slice that, to make sure that all of the provisions that we put into place are equally accessible and address the concerns of the broad diversity of our community. The last thing I want to highlight before taking questions is recently some of you may have become aware of case reports of pediatric illness related to COVID-19. Now, as a pediatrician and from a pathophysiology standpoint, I find this fascinating, is over the course of the COVID-19 illness projections, kids have been kind of off the radar. Most of them, the majority have had very mild symptoms. We've not seen, and in fact, in Montgomery County, knock on wood, none of our deaths have been anyone under the age of 18. But what we are seeing are case reports popping up of children experiencing inflammatory type illness secondary to COVID infection. And that illness mimics another condition called Kawasaki's disease. I've had the opportunity to treat Kawasaki's disease in concert with infectious disease specialists, and it can present in atypical fashion. And so there are case reports. I know that Children's National Hospital is taking care of a number of children who've exhibited these symptoms. Because that's been in the news recently, I wanted to let folks know that as best as we know, none of our pediatric cases of COVID-19 have experienced those types of symptoms, but it's something that we will continue to look into and provide more information so that folks are aware and have an understanding of what's happening. I'll stop there and happy to answer any questions with the county executive.